going to start by knocking. Come in, introduce myself. Jane, I'm your nurse. Today I'm going to do a cardiac assessment. So I'm going to wash my hands, provide privacy, so I'm going to shut the door and shut the curtain. Then I'm going to have 2 identifiers. So I'm going to ask Jane what her name and date of birth is. Then I'm going to actually check her name band to ensure it is in fact Jane. Then I'm going to make sure the patient is safe. So this is probably, for this type of assessment, I'd have the bed all the way down and probably have the patient sitting on the side of the bed. I'd make sure to have the side rails up, the upper side rails up for safety. All right, and then I'm going to assess the level of consciousness. So she appears to be alert and oriented, but I would probably ask questions like, do you know where you are, who the president is, what year it is, things like that, to make sure that she's alert and oriented. Then I'm going to assess the skin. So in this case, I would assess the skin of on the chest. So I don't see any lesions or scarring, bruising. It's pink in color, warm, so the skin is good. And then I'm going to assess the thorax. So I'm gonna assess the shape. So I'm just gonna kind of put my hands anterior and posterior and assess the shape from all sides. I don't see any barrel chest, which would indicate COPD. And she doesn't have any, she's not using any accessory muscles to breathe. Her breathing seems to be pretty normal. And then I'm going to just make sure her respiratory rate and rhythm is normal, and it seems to be within range. And then I'm going to, I've already palpated expansion and everything of the chest and everything, and it seems normal. Then I would listen to the lungs. So places anteriorly for breath sounds. So I'm gonna use my stethoscope. I'm going to listen for breath sounds. So I'm going to start above the clavicle up here and go on both sides, right and left. Then I'm going to go down to the second intercostal space on both sides again and listen. Then the fourth intercostal space on both sides. I'm going to go a little bit lower on both sides. Okay, sounds normal. And then I'm going to, on the posterior side. So on the posterior side, you want to make sure you're not listening over the scapula, because obviously you're not going to be able to hear it too well. So I'm going to start up at the top here and go on both sides. So then you kind of go around both the scapulas on each side. Okay, sounds normal. Then I'm going to listen to breath sounds on both sides. So axillary, the subaxillary. So have the patient lift their arm, kind of listen in. Okay, sounds good. Both sides. All right, then I'm going to pulsate the carotid artery one at a time with my fingers. So I'm going to start on the left, one at a time. Okay, I don't feel any feelings of it being thready. It just seems normal. Then with the bell of my stethoscope, I'm gonna listen. Each side one at a time again. I don't hear any bruits, no slashing or swishing sounds, anything like that. And then I'm gonna feel for heaves or thrills. So I'm gonna go on the left side, place my hand on the left side, and feel for any abnormalities. And I don't feel any of that. Oh, I'm sorry, over here. And I'm not feeling any abnormal breathing or anything like that. Okay, and then, so now I'm gonna listen to the different valves. So for the aortic valve, we're gonna come down on the right side and go down to second intercostal space. Okay, sounds good. We're gonna go on the left side to the second intercostal space. This is the tricuspid valve. Okay, then we're gonna go down to the fourth intercostal space here. Okay, now the fifth intercostal space. So it's going to be the fifth intercostal space, mid-clavicular line we're going to listen for. And it all sounds normal. So now I'm going to make sure the patient is safe. So I probably put her back in bed or in the chair if she wanted. Pull her side table near her, give her her call light, make sure that both of the top side rails are up, the bed is all the way down. I'm finished, so I'm going to wash my hands, pull the curtain, open the door, and that would be my assessment.